Hi everybody, I'm Marla with 9 Health, and I am here today at the Pepsi Center where we are hosting our first of the season in the fall health fairs. So this is what you're seeing in the background. We have volunteer medical professionals here set up ready to draw blood and take people's so you can get your health screenings. We have 8 different health screenings you can take advantage of that are really a good indication of your wellness and health. And so if you're in the area, this is super easy. Come in, there's free parking. You can get in and out very quickly, and our volunteers will help you. So let's take a look at what's going on. People are getting their blood drawn. There's blood pressure screening here. And then one of the important things is we have flu shots. So at all of our health fairs this fall, and there's 27 of them, there will be free flu shots with our partners from Albertsons Safeway. So we're really lucky, and if you come on out, you can either get a flu shot at most of our sites, or at the very least you'll get a flu voucher that you can take to any Albertsons Safeway in Colorado and get your flu shot. So this is great. You can also spend some time, ask a medical question. So we have medical professionals. Hi! Thank you for being here.
You're welcome.
We have volunteers who will answer your questions. And how often do you get to spend quality time with a professional who will just answer any questions you have? So really, thank you for being here.
Someone asked where we are.
We are at the Pepsi Center, people. So we're at the Pepsi Center here today for 9 Health Fair. It's our first of the season. We have 27 coming up this fall. And if you can't make it out today, we're here till 11. So if you can't make it out today, we have some this weekend. One at Heritage Todd Creek and one at St. Pius X Catholic Parish in Aurora. So today we're going to talk a little bit about something that's very, very important. It's insurance. And many of us are not that knowledgeable about insurance, and it seems really confusing. And so we wanted to bring you this education about insurance, Insurance 101, to help you understand, we want you to be healthy, but all of us are eventually going to need some medical assistance. And so that's why we're here with Ezra Watland from Connect for Health Colorado. Thank you for being here today.
Good morning. Thanks for having me.
Yeah.
We're really excited to be with you today.
And we're going to quiz you about insurance.
Okay.
It's something that most of us don't understand a ton about.
Right.
And you do.
Yeah, we understand it's a challenging process. It's important. It's the first step to leading a healthy, active lifestyle, and we want to be there to help you through the process because we understand that it's complicated.
So tell us, for those of us who don't know, maybe people don't know, what is Connect for Health Colorado?
Yeah, Connect for Health Colorado is the state's official health insurance marketplace. So we are the one place in the state of Colorado where you can come in and shop on the individual market and receive a tax credit that helps you afford your monthly premium.
Okay, so you can shop for plans on the website, and you've got a lot of education on there. If you care to go through it. And how else can you get help from Connect for Health Colorado? Because you can. There's a lot of ways.
Yeah. Well, like you said, one of the first things that you can do is you can go to our website, connectforhealthco.com. We have a whole host of information there. You can read through different components of health insurance to get to understand it better. We also have some tools that will help you take a look at what might work best for your budget and for your family situation. So help you understand.
Actual calculations.
Yep, exactly. Some calculations that will help you understand what you might be looking at in terms of your monthly premium, what plans might be available in your area, because it's different all across the state. And then if you have any other questions, we have great resources around the state as well. So in-person help that's available for you. So experts like myself that we partner with across the state of Colorado that can guide you through the enrollment process. And then you can call us as well, and we can guide you.
And we'll put that phone number in the feed, so you don't have to remember it, you don't have to write it down, but we'll put it in the feed so you can always refer to it. Again, we're here, if you're just joining us, at the Pepsi Center for 9 Health Fair, and you can come out here till 11. We're talking today about insurance with Connect for Health Colorado because insurance is so important. If you have questions, you're welcome to type them into the feed. Stephanie, who's behind the camera, will shout them out to us. We'll answer your questions the best we can. If we can't answer your question for any reason, we'll research it for you and we'll put an answer in the feed. So go ahead and give us a shout out. And why is this important now? Why are we talking about this now? It's not just because it's important, but open enrollment's coming up.
That's right. So not only is health insurance important, and we want to make sure that folks understand that, we also want to remind you that open enrollment is just around the corner. So starting November 1st is the one time a year that everybody can sign up through Connect for Health Colorado for their next year coverage. So starting November 1st, you can sign up for 2020.
That's right. And if you fail to do that, right, then you are going to be with your old plan, or what's going to happen if you fail?
That's a great question. So if you're already signed up for coverage through Connect for Health Colorado, you might qualify to just auto re-enroll in your plan. If that's the case, you'll receive a note in the mail letting you know in advance. If you have any questions, any doubt about it, I encourage you to give us a call just so you make sure. Okay. And even if you are going to just automatically re-enroll into your current plan, I still think it's important to shop every single year. Plans change every single year. Prices change every single year.
Okay, so things might have changed.
Yep.
Plus, your personal situation could have changed.
Absolutely.
You
absolutely.
could have been, it depends if you have now a new health condition, or you're expecting to have a health condition, even a pregnancy. That could change what plan you want to buy. Isn't that right?
Yeah, absolutely true. I think it's always a good practice to just once a year take a look at what you have, see if it met your needs last year, take a look at what the plan is going to look like next year as well.
Okay, so now we're going to quiz you.
Okay.
You ready?
Right.
So
ready as I can ever be.
There are these insurance terms that people throw around like all the time, and maybe a lot of us don't even really know what they mean. So, for example, let me just think of one, right?
Sure.
Okay, what about deductible?
Yeah.
What's that mean?
Yeah, so this is where it gets a little bit complicated, and we understand that. And again, we're here to help guide you.
So give us the simple answer.
So a deductible is the amount of money that you have to put forward for your medical expenses before your insurance company is going to start putting in money as well.
Yeah, some of us don't even think that we have a deductible, right? And then we find out when we go to get medical services that we do. So you want to know what that is.
Yeah, and the range could be anywhere from $0 deductibles, so your plan would pay right away, to deductibles that are thousands of dollars. So it's really important to pay attention to and make sure that it's something you can.
Okay, right along those lines, let me throw another one at you.
Sure.
Premium.
So your premium is the amount of money that you pay every month to have your health insurance. It's sort of like you pay for your car payment, your car insurance payment every single month, and then if you have an accident, you have to pay up to your deductible before your car insurance kicks in. It's the exact same way that health insurance works.
Okay, here's another one. Copay.
Copay. So copay is what you have to pay when you go to the doctor's office to be seen. It could be $25, it could be $50. Essentially, it's the amount of money that your insurance company has agreed with your doctor to pay when you go for your general visits.
Okay, so those are all I know. Did I miss any that you think people should know about? So
there are more for sure, and we have guidance on our website to guide you through them. Other things that you might want to consider are the maximum out-of-pocket expenses.
Okay, yeah, out-of-pocket max.
Yeah, so that's the amount that you'll have to pay grand total before your insurance company will just pay 100% of your costs after that. Could be, again, it could range from a few $1,000s to tens of thousands of dollars. So it's something that you want to pay attention to.
You really want to know what that is.
Yep.
Okay, good.
And again,
you did pretty well on this quiz.
Yeah, thank you. I appreciate it. Yeah, I've had to go through this quiz a few times.
Yeah, I bet. We talk about it a lot. So if you have questions for us, go ahead and type them into the feed. Stephanie will yell them out to us, and we'll try and answer your questions, because Ezra seems like he's pretty knowledgeable.
Yeah. Well, and I just want to remind folks, if you forget these terms, you don't have to memorize them. Just remember that we're here to guide you through it, and that we have experts across the state that will walk it through and make sure that you're considering all of these different components when you're signing up for coverage.
That's right. And some of your assisters or experts are going to be at some of our health fairs.
That's right.
And you can go to a health fair and get some of this information too. So
yeah, we'll have several of our enrollment assisters at the 9 health events that are happening across the state.
Okay. So tell us a little bit too about why health insurance is important. I mean, we talked about health insurance, but some people might think, I don't really need that. I'm really healthy. I'm going to be okay. Yeah.
Absolutely. We all want to stay as healthy for as long as we can, and health insurance is vital to being a part of that. It's really important to think about not just going to the doctor when you get sick, but to also make sure that you continue to go to maintain your healthy lifestyle. So the health insurance plans that are sold through Connect for Health Colorado offer things like free preventive services. So you can go and get your annual wellness checkup. You could get your flu shot and other vaccines just to make sure that you stay healthy for as long as possible. And then the other thing to always remember is none of us want those big illnesses or accidents to happen, but they do happen. And health insurance is there to help prevent any of those major expenses from being too much to bear on your own.
That's right. So you could get into a really big debt. I mean, I've even heard that the medical expenses are the #1 reason for bankruptcies.
Yeah, absolutely. Yeah, and that especially happens for folks that are uninsured or underinsured. And underinsured means that you signed up for a plan that might cost a little less money, but not offer all of the benefits that you might have hoped that it would.
That's right, that's right. Okay, so we quizzed you a bunch. If you guys are, yes, do we have a question?
Someone had asked on our Facebook earlier if they're diagnosed with something, and want to switch plans after they're diagnosed to find something better, how do they navigate that?
It's a great question. It's important to remember that open enrollment is only one time a year. That's the one time per year that you can sign up for coverage. And then when you sign up for that coverage, it's for the rest of the year. There can be exceptions to that, but they're really related to if you move from another state or if you lose coverage through an employer. It's not because of a health diagnosis that would give you the chance to sign up for a new plan.
So what you're saying is you really can't sign up for a new plan once you've been diagnosed with something.
Correct.
Until open enrollment.
Until the
comes
next
available.
open enrollment.
Okay.
Yep.
Okay.
And then Lisa had asked, is it required by the government to have health insurance? So just talk about it.
That's a great question. There was a requirement that was in place that has now gone away. I think regardless of whether the government says you should do it or not, it's just a good thing to have so that you can maintain a healthy, active lifestyle.
That's right. So you don't have to anymore, but it's always a good idea. Yeah.
And then Tina just asked, how do you know which deductible to use?
Which deductible to use? That's a great question, and honestly, I think the answer is different for everybody. If you're looking for help with that, I would really encourage you to reach out to some of the enrollment assisters and brokers that we partner with around the state who are experts in guiding you through this and can help you understand the pros and cons of plans with lower deductibles, which often means that they have higher premiums, or plans with lower premiums and higher deductibles.
So as a general rule, I think about it, if I know I'm going to be using my health insurance a lot for whatever reason, then a lower deductible might be a good idea for me. Whereas if I'm really not going to use health insurance that I know of, I feel like I'm pretty healthy, then maybe I can get away with a higher deductible. Does that sound right?
I think that sounds right. Again, I think it's a really personal decision, so you'll have to think of the pros and cons of each of these. One thing that I'll mention, the plans that are sold through Connect for Health Colorado occur at a few different what we call metal tiers. So there are bronze plans, silver plans, and gold plans. And they're built exactly like you said, so that the bronze plans generally have higher deductibles but lower premiums. They'll be a little bit more affordable month to month. And that might be something, if you're not a high utilizer of healthcare, that you might want to look at because it'll be a little bit cheaper. But if you're using your healthcare really regularly and you want to pay attention to what those expenses are going to look like over the course of the entire year, you might want to consider shopping for one of those silver or gold plans.
And you have those kind of calculators online that
absolutely. Again,
and is it connectforhealthcolorado.org?
Yep, again, you can go to connectforhealthco.com. It's .com.
Okay, got it. Listen to him, not me. Connect, say it again.
Connectforhealthco.com.
And we'll put it in there.
And we'll put it in the feed.
Great, we'll put it in the feed, and there you can find several tools. So again, you can find those experts in your community that can guide you through this. You can also find some of those tools where you can put in your household information to get a better sense of what plans are available and what the costs are going to look like.
So you can see there's a lot of questions. People really wonder what they should do about this insurance, and what we want to kind of leave you with is that there are resources for you. And our intention at 9 Health is to really provide you with that objective, unbiased education and information, which is why we partner with people like you at Connect for Health Colorado, where it is going to be unbiased information. There's resources online. You can go and find out. It's not necessarily you're going to try and sell you anything, but you can purchase a plan there. And also, there's people you can call. So if you're like me, it's hard to go through all that education by myself online. So you can call somebody. I think you have chat, is that right?
Absolutely,
you can chat, you know, so whatever you need. And you can go to a health fair, and there will be assisters at many of our health fairs this fall. So don't be afraid to do that. I do want to let you know that we're here at the Pepsi Center. If you're just joining us, we are at Fall 9 Health Fair, where you can get all sorts of screenings and health screenings to make sure you do stay healthy. We're here till 11. There's 27 more dates this fall that you can take advantage of. We have 2 this weekend, one at Heritage Todd Creek, one in Aurora at the St. Pius ex Catholic Parish. So if you can't make it out here today before 11, all of our health fairs are going to have free flu shots or vouchers, so it's a great opportunity, one-stop shopping.